Ah, shucks. It looks like you scraped your knee. One of those pesky coffee tables jumped out and bit you. Well, I'm going to show you how to go over quick wound care for a basic wound that you may come across, such as this. Alright, so our first step for wound care is going to be gathering the supplies. Here I just have some basic napkins. I grabbed 2 of them. I mean, most households have napkins, and if you don't, you should probably get some. Right here I have a pair of gloves. These ones are a little bit special. These ones are sterile gloves. They don't need to be sterile, for what we'll talk about in a bit. I have scissors just in case you need that for dressings. Here's a typical band-aid that you might use on a wound like that. But because it's in a weird location, we're gonna make our own type of wound care dressing. We're gonna make it out of tape, Coban, and gauze pad. We also have medical tape. This is tried and true, but if you keep using it, it will cause skin breakdown. And then we have this. This is just a little cotton applicator. You'll often see this to like remove makeup. It's cheap, just as effective as this. So we're gonna use that. This is eye contact solution. It works just as well as wound irrigation and hydrogen peroxide to clean our wound. Alrighty. So our first step before we actually start our wound care and our dressings is going to be washing our hands. This is important and it's the most effective way at minimizing our risk for infection because it mechanically and chemically removes the bacteria on your hands and prevents it from entering the wound. Usually you want to do about 20 seconds for this. A good rule of thumb is you could sing your ABCs while you're doing it. So make sure you get the back, the front, your thumbs, under your nails, and in between your fingers, and you'll be all good. Rinse them off. Try not to touch too much. Dry them off on a clean towel. Now that we washed our hands and got all those pesky germs off, we could go ahead and care for our wound. I'd like to mention that it's important to wash your hands before you care for your wound because this mitigates your risk for introducing new bacteria and infection. So right here I have a napkin. In any typical household, you should probably have a napkin. So we're just going to go ahead and put this pressure on the wound, kind of stop the bleeding, and also clean that blood off and get a better look at our wound. Okay, so we'll go ahead and wipe that off. Alright, so we see our wound. Bled a lot more than how bad it really is. So what we're going to do now is we're going to clean it. Right here is hydrogen peroxide, 3%. Don't use this every time you care for your wound. It's important to use it for the first time because it kind of eats at all those germs in there. But it's also important to remember that wounds are naturally going to have bacteria in it, and that does not mean that they're infected. So I'm going to put some hydrogen peroxide on this and just let it sit. This is a cotton round. You could buy something like a gauze pad like this. Cotton rounds are a lot cheaper and more accessible to get. So if you're looking to save money, they work just as good. We're just going to let this sit on here, usually about 30 seconds to a minute. Alrighty, and then after that, we're going to take this off. Looks like our wound is all done bleeding. So what we want to do with wound care is keep it moist and keep it covered. Right here I have a little gauze square that I mentioned before. This is going to cover the wound. And right here I have eye contact solution. You could buy like wound irrigation, which is really just the same thing. It's a little bit more expensive. But this is a sterile solution because you have to put it on your eyes and it works just as good. So we're going to remove the gauze pad, being careful not to handle the part that's actually going to be placed on the wound too much. So we're going to pull it out, place it on here. And the neat thing about this is since it's absorbent, this liquid will soak right through. Okay, so after you let that soak for a little while, we're going to go ahead and wrap it with this self-adhesive tape right here, also known as Coban. So we're just going to place it right here and then wrap around. The nice thing about this guy right here is it's self-adhesive, so it won't chew up your skin when you're pulling it off. And it's a little bit more secure than a Band-Aid because those things tend to fall off, especially if you're moving a lot and you're like a highly active person. And another thing to mention is they're cheaper because you get to make your own Band-Aids. And just like that, you've done wound care.